Hello, viewers. Welcome to our series on problems pertaining to your brain and spine. It's an awareness video that helps us to understand our brain and spinal cord better. My name is Dr. Ubong Ekpene, a consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, and also a lecturer with the University of Uyo. In our last video, we had discussed a very common symptom. That was headache, and we looked at the types of headache. We considered a primary headache, basically. But we had mentioned in that video that we would have subsequent videos that will highlight more on the secondary causes of headache. And today we are going to consider one of those secondary causes, and that is brain tumor. We are going to do, or I'm going to do just an overview of brain tumors, and in subsequent videos, we'll now go into more specifics. So what is brain tumor? Brain tumor is an abnormal growth of cells within the brain. So certain cell lines in the brain have developed the tendency to escape the control in their growth rate, and they grow faster than other cells in the brain, resulting in compression of the surrounding brain, causing symptoms that patients may experience. So what are the types of brain tumors? We can classify it into two categories. First, as cancerous and non-cancerous. Cancerous brain tumors refers to those tumors that tend to grow very fast and has the capacity to spread from the brain to other parts of the body, and sometimes from other parts of the body to the brain. And they're also called malignant brain tumors. And the non-cancerous brain tumors are those ones that develop have a slower rate of growth and do not have a tendency to spread to other parts of the body. So those ones, when taken out, almost always guarantees a cure, provided it is done successfully and taken out completely. Another way of classifying brain tumor is as primary or secondary. Primary brain tumors has to do with brain tumors that develop from the brain itself ab initio and grow to different sizes. While secondary brain tumors are tumors that develop from other parts of the body and has a tendency to spread to the brain. So what are the risk factors for developing brain tumors? Risk factors, number one on the list is exposure to what is called ionizing radiation. Ionizing radiation includes things like X-rays. If you've had multiple sessions of X-rays, the more you're exposed to X-rays, the more the tendency to develop cancer later on. Also, if you've been exposed to CT scans, multiple sessions of CT scans, that itself can predispose to development of cancer. But more so if you work in an industry or you work in facilities where these are used on routine basis, then that increases the risk more. Those who work in petrochemical industries, who are exposed to certain chemical agents in those industries, may have increased risk of developing brain tumors. Those who smoke, smoking can cause, cigarette smoking can cause cancer in any parts of the body, including the brain. Also, immunosuppression, those who have HIV, AIDS, those who have certain forms of immunosuppression can be predisposed to development of brain tumors. Also, in some families, people have a tendency to develop certain tumors, including brain tumors. And that is because one of the family members, their progenitor, those who were there before them, may have been exposed to certain agents that caused changes within their genes that resulted in the increased tendency to develop tumors, including brain tumors. And these can be transmitted genetically to the offspring during the period of conception. And they grow up with increased risk relative to others who don't have that predisposition. Also, somebody who has had a tumor in any part of his body, those tumors may be cancerous or may undergo malignant transformation, changes from non-cancerous to cancerous, with tendency to spread to the brain. Age may also be considered a risk factor because there are certain tumors that tend to occur more in the younger age and those ones that tend to occur more in the older ages. Even gender, females tend to be predisposed to certain kinds of tumors compared to males. For instance, meningioma and pituitary adenomas, pituitary tumors. These tend to occur more in females relative to males, while a man who has prostate may develop prostate cancer, which may spread to the brain, which females are not predisposed to. All right, so these are just a few tendencies or risk factors. So, how do brain tumors manifest? Sometimes they manifest with persistent headache. Um, those are the kind of headaches that you don't wish away because they stay on. The headache is persistent, unrelenting. You take medications, they don't go, they may reduce in severity, but never completely goes. And may be associated with what is called nausea. Nausea means that a feeling of wanting to vomit, or actually the person may feel like vomiting and actually vomits. Sometimes the patient may be associated with violent shaking of the body that we call convulsion. So the patient begin to twitch different parts of the body or the entire body, may foam from the mouth, may bite the tongue, may clench the teeth. Um, Another name for that is seizure. So if you see somebody who has never had a seizure before suddenly develop seizure, that may be a pointer something is wrong in the brain there. It may be a tumor, especially if it's an adult. Also, the patient may have some unsteady gait. Notice somebody was walking well, all of a sudden is no more walking well, not because he has a problem with his legs, but it's a problem with balancing. They come from the brain. And also, patients who tend to have difficulty with their vision, they were seeing clearly, the eye doctors examine their eye, there's no problem, maybe from the brain. May also be seeing double vision, or one side of the body is weak, or the patient suddenly now starts having memory problem, or is not talking well. All these are pointers to the fact that this headache the patient is having is not ordinary. It's not the one that you call primary headaches that you can just ignore. That patient needs to see a doctor. What would a doctor do? He will take a detailed history, medical history, to determine the risk, the factors, and also they analyze the symptoms, which will help him examine the patient. And with further investigation, like a scan of the brain, that may point to a brain tumor. Of course, what happens in that instance is that the neurosurgeon needs to see. The neurosurgeon is the one trained to handle such problems. And when the tumor is taken out, sometimes the patient may require other forms of treatments called chemotherapy using drugs, or radiotherapy, meaning that they use radiation to try to kill the cells, or immunotherapy. These are all supportive care to ensure that the treatment outcome of that patient is better. So this was just an overview of brain tumors. We'll be more specific in our next video. Thank you for your attention and have a good day. Bye.